Welcome to today's Explainer. We're jumping right into a clinical pronunciation diagnostic. This is based strictly on a native U.S. English 100-point baseline. We'll be evaluating automatic speech recognition, or ASR, transcription data to pinpoint exact mechanical phonetic failures and successes within our audio sample. We're looking at this purely objectively. What exactly did the machine parse? Why did it parse it that way? And what precise articulatory movements caused that transcription? Let's get into it.
All right, so looking at the data, the overall pronunciation score sits at a 68 out of 100. Just for context, 100 represents a native American English speaker, and 0 represents a CEFR A1 baseline. The diagnostic rationale here is actually pretty fascinating. The speaker has highly intelligible overall pacing and vowel formation, definitely reflecting a solid B2 or C1 level. And because of this solid rhythm, the ASR successfully captures complex medical vocabulary, words like socioeconomic and perforations. But the score caps at 68. Why? Because localized critical phonetic substitutions in consonant clusters are causing some really severe semantic shifts. Basically, the rhythm is there, but mechanical consonant errors are literally altering the meaning of the transcribed words.
Moving on to Section 1, our IPA analysis. We're going to look at this in strict ascending order of phonetic execution.
Starting with the lowest scores, the most critical mechanical failures, we're isolating the two most catastrophic phonetic errors in the sample that need immediate intervention. First up, the L phoneme. This one scores a 30 out of 100. The mechanical failure here is that the L is being substituted entirely with erotic R in medial positions. The direct evidence? Well, the intended word was cartilage, but the ASR definitively transcribed it as cartridge. That's a total loss of meaning right there. Next is the Z phoneme, sitting at a score of 40. In word final positions, this fricative is being aggressively stopped, affricating into an unvoiced Z or D sound. Because of this over-articulation, the intended word nose was transcribed by the native-trained ASR as nodes.
Moving slightly up the scale, we hit the schwa, the sound, which scores a 55. The issue here is highly insufficient vowel reduction in unstressed grammatical words. Since the schwa isn't executed properly, it causes direct prepositional confusion. For instance, the machine heard the word for but transcribed it as from. Then we have the V phoneme, scoring a 70. Now, while it's generally recognizable in rapid speech, it lacks sufficient labiodental friction. The ASR did manage to transcribe words like vessels and severe correctly, but our diagnostic indicates this was actually just a reliance on heavy contextual prediction by the AI, rather than mechanical phonetic accuracy from the speaker.
Now, this data brilliantly illustrates the transition into the speaker's more competent ranges. The I vowel sits at a 72. It's recognizable, sure, but the speaker elongates it slightly toward the tense E sound. It's just missing that crisp, relaxed articulation characteristic of American English in words like witnessing and pyramid. Conversely, check out the S phoneme, scoring a really strong 85. The speaker exhibits sharp, accurate sibilance here. Even in highly complex consonant clusters, like in the words obstructions or surgery, the S is successfully and clearly parsed.
Here's where we see highly stable articulations. The K scores an 88 with correct velar placement and aspiration. The J affricate is exceptionally well executed at a 90, successfully parsed in words like damage and surgery. But the real standouts? The bilabials. The M scores a 92, exhibiting a bilabial nasal resonance that is genuinely native-like, captured perfectly in membrane and pyramid. Finally, the P phoneme maxes out the speaker's range at an impressive 95. The plosive aspiration is structurally sound and acoustically clear, handled perfectly in words like patience and privilege.
All right, Section 2, target words. Here we'll focus on lexical precision and priority improvement.
So how do these isolated phonetic successes and failures actually manifest in continuous speech? Looking strictly from lowest to highest score, these are the absolute priority improvement targets. Cartilage scores a mere 20. It completely morphed into cartridge for the ASR. This happened because of the total failure of the L phoneme we talked about earlier, combined with incorrect syllable stress applied to the suffix. Then we have the word nose, scoring a 35. The intended word was output as nodes because, as we saw in the IPA data, the final fricative Z was aggressively stopped, introducing an unvoiced D sound right before the sibilant. Again, these mechanical failures are causing complete semantic loss.
Continuing with our priority words, the preposition for scores a 45. The ASR output from. Why did that happen? It comes down to incorrect placement of the tongue and lips during the rhotic schwa, which actually led the ASR to assume a bilabial M ending. Then we have pyramid at 68. The ASR did capture the word correctly, which is why the score is higher, but the phonetic spacing reveals a mechanical flaw. The speaker used equal syllable timing, also known as mora timing, rather than the stress-timed reduction required on that final syllable in American English.
Next up, the word obstruction scores a 72. The complex suffix was parsed perfectly, but the initial schwa was just way too heavy. It was pronounced almost as a full ah vowel, which severely reduces the natural flow of the sentence. Moving into the refinement category, the word vessels scores a 75. The initial V was identified contextually, but the syllabic L at the end of the word lacked the characteristic dark L velarization typical of American English, so it ended up sounding much closer to a vowel than a heavy back-of-the-throat consonant.
As we look at these refinement words, the errors get a lot more subtle. Severe scores a 78. The vowel transition was parsed perfectly, but the rhotic ending missed the mark. It lacked the deep retroflex or bunched tongue posture necessary for a Native American R. The word visible scores an 80. It was captured accurately by the ASR, but it gets a minor deduction because the middle Z sound was noticeably over-articulated, and that actively slowed down the cadence and rhythm of the phrase.
Finally, we're wrapping up our lexical data with the absolute strongest words in the sample. Surgery scores an 85. The speaker successfully executed a highly complex transition from the R directly into the G affricate. Beautifully done. And reconstruction sits at an impressive 88. This is a great example of excellent multisyllabic execution. The primary stress on the struck syllable was strong and accurate enough to guide the ASR perfectly through those surrounding really dense consonant clusters. So what is the ultimate takeaway from all this data? It's simply this: phoneme precision governs semantic accuracy. Intonation and pacing alone cannot save a transcription if the foundational mechanics of your consonants fail. Aggressively correcting the lowest scoring L and Z consonant clusters is absolutely the solitary path to preventing future native-trained ASR transcription failures. The rhythm is already there, the plosives are there, but if cartilage becomes cartridge, the message is entirely lost. Think about it. If a machine can't decipher the target word due to tongue placement, how much cognitive load is a human listener being forced to take on?